Well, this one's very chilled.
The love drug.
We chat, we shoot the breeze for a bit. If you say anything racist, we cut it out or we blackmail you with it later.
You're recording.
I've got so much shit on Rob.
Oh, you fucking
Anti-Semitic,
It's great, like a bloopers compilation of non-PC stuff.
100% that'll get us cancelled, eh?
But it's just say it was a deep fake, AI. Yeah. Who's your biggest enemy? Blame it on them.
Hello, how are you? Sorry, we haven't started yet. Or maybe we have.
We have.
But I mean, you'll be cut in.
You're cut in. Yeah, it's I think I've been reflecting on this today around the idea of if your younger self looked at you today, would they be proud? And would your future self look at you today and go, thanks, bro, you're actually doing me a solid? So I think, and we like to just go a little bit, Rob's one of those guys who is successful and looks successful. So you do, whether you want to or not. We get a lot of youngsters that come up to Rob like, what do you do, bro? How do you have these things? How do you have these businesses? And I think we want to start monetizing that. No, we want to start tapping into meaningful men that are doing similar cool stuff. And like I've tried to avoid actually chatting to you in the gym because I'm so interested in learning about you and asking these questions from a place of not knowing. And I think Rob's always held you in high regard. So actually when I first met you, you are much younger than I thought you were.
Trying to tell me I look old?
No, you are much younger. No, you sound old when people describe you.
Okay.
The way you walk, no, I'm joking. It's the credibility you hold. Like when someone mentions you, I go, oh yeah, that's a guy who's been doing it for obviously multiple decades.
You have a very good reputation.
Absolutely.
In the not you hearing it world, if that makes sense.
So someone says Dr. Ehlers and I saw you and say, oh, that's Dr. Ehlers. Oh, this is, that's like, I know there's a lineage. You come from a lineage of learned doctors.
Yeah, I mean, there's the OG, who's my dad.
Yeah.
And I think, if anyone has a phenomenal reputation, it's him. I mean, he's been in the game for 25 years down here in Durban. And it's probably one of the most frustrating things walking with him on the promenade because everybody stops and greets him, So if you're out there to get your steps in, it's going to take you 2 hours to get that done. But if you know my dad personally, I mean, you can talk to him about anything. He's a super open, cool dude.
He's been my doctor for the last 15 years, so
yeah,
I love him.
And I think it's always just there to provide his best and get people to feel their best at the end of the day. And yeah, myself and my sister, both doctors, and then Vince, who you'll probably have an opportunity to meet soon. I think he'll also be great for a format such as this. I mean, he's got his own sort of realm that he dominates. Yeah.
He did my hair, guys.
He's the hair guru.
Yeah. And he's good. Like, 2 months in and I'm already getting Brussels sprouts coming out of my head. I'm like, yes. There's hope for me.
So you come from a lineage of good stock, right? And I think there's this, like a lot of people will go and say, okay, you came from a doctor. Obviously, that was the natural path. Was there ever something, did you know from the get-go that you were going to be a doctor?
I think as a young boy, you always look up to your dad as a role model. So here's this guy, you put him on a pedestal and you're like, wow, I want to be like him. And then I think as you go through your teenage years, you become a little bit rebellious and you're like, nah, I want to do something else. And there's this degree of uncertainty as you learn how to find yourself. So probably around the age of 16 or 17, I was like, the last thing I want to be is a doctor. But I'd already committed to these subjects in high school that was going to take me on that path. So I was in a bit of a predicament. I was like, well, what do I do if this is not what is really planned for me? So I went and saw an educational psychologist, probably around the age of 16. And they put me through a series of different tests, all kinds of little questionnaires and puzzles and whatnot. And at the end of it, the summary of it was, you're good with people and you're good with problem solving. And that was the answer.
Yeah.
And they said, if you pursued medicine, you'd be good at it. But it didn't really tell me if that's what I should become. So at the end of grade 11, I was fortunate enough that I was academically inclined, and I used those marks to apply to universities. My first choice was Stellenbosch University. And I was like, shoot your shot. Truthfully, if you get in, maybe it's your calling. If not, now you can start looking at other things. Business was very much on the top of my mind at that point. So we went down to Stellenbosch University, got to meet the registrar, got a cool tour, and I was like, I could dig this. So applied, and then I received provisional acceptance into medicine. And kind of from that point, I was like, cool, path is set, that's the way I'm going to go, I'm going to become a doctor.
Yes. So, and did you ever, so you had that path that was kind of set out for you. When you say you were academically inclined, like you were naturally, you didn't have, you enjoyed studying, it was fine.
Extreme student,
Yeah.
I'm assuming.
Yeah, look, I, from a young age, I think had this not pressure, but expectation to perform. Yeah. And because of that, you put in hard work. I was in a competitive primary school, academically, I mean. And for that reason, you want to come out top dog. So the competitive fire kind of started at a very young age from that point of view. When you enter high school, now you've got a group of different people from all around the world, all around the country, that are equally, if not more, inclined than you are. So, now it's a different level of competition. So,
levels out.
Well, yeah, the playing field changes entirely, especially with things like sport. You're in grade 7, you're considered a first team athlete for cricket, for example, but then you go to the grade 8 trial outs and there's 60 boys going for 11 spots, and you realize, well, geez, there's some guys here that can do things better than I can. Yeah. And with academics, it was the same. So you always had to try and outwork your doubts a little bit. Don't get me wrong, I've always, and probably still to this day, have a degree of procrastination. It's probably the thing that's my biggest downfall.
It's a man thing, dude. It's not a you thing. Like, I am the worst at it.
They say procrastination is like masturbation. First it feels good, but you just end up fucking yourself. So
I've not heard that one.
So that was kind of the thing that always I had to try and navigate around. And eventually start developing some systems. And that's kind of just how it's hard work. I think I have a logical mind that can conceptualize things quite easily. I think I know a lot about a lot of things, but not probably a master at any specific topic.
Yeah.
Well, I feel like I'm both of us pretty much in the same there.
Yeah, you're smart enough. And I worked with a guy that was genius level when we were doing our articles. And he just understood stuff. Didn't have to study for board. But the function of that, or the consequence of that, is what he procrastinated, because everything could be done at the last minute. The system didn't actually cater for someone that was
savants.
Yeah. And he used to get away with it. He used to party. I mean, I remember before his board exam, he was out drinking, came top 10 in the country, which is like insane. So, but he was a lazy dude. And thank God someone actually found him and recognized potential, and they took him out of purely finance and they put him in systems. And this must have been 15 years ago, before AI was ever a thing. And man's excelling. Like, he's in the Cayman Islands, director of one of the big 4. But that consequence is like, you always say this, that interesting and frightening stat. Think about the average intelligence of a person, right? Then half the people in the world are dumber than that. Systems have to cater for the majority.
That's why we have rap music.
The cool thing you mentioned, and I say cool because when someone looks at you, right, the risk is that you're not relatable because, mate, you train well, you look good, booming business, great reputation, good looking, doctor, you know what I mean? Like it's these things, you become unrelatable, right? And so the question, what I try and get to here is not to expose someone, but to get them to the point, like you mentioned the word doubt. Someone's going to watch this and be like, whoa, you suffer from doubt. Like, but look at you. I suffer from doubt, you know?
But look at you.
Yeah. But that idea that you've had to overcome doubt, like how does that manifest? So you look at yourself, do you ever think, I'm not good enough? Or you hold yourself to such a high regard that it's almost self-defeatist?
I think everybody's got their insecurities. I mean, I'm not special, unique in any way there. Mental resilience is something that you have to fortify. And I've had to learn how to do that the hard way. I mean, I've had my ups and downs. I'm not going to deny that. But it's about picking yourself back up at the end of the day. And I think sometimes you can be your own worst enemy because you can get stuck in your own head. You know, exactly. Whether it's imposter syndrome or you're affirming to yourself that you're not good enough, you know, you can convince yourself that you aren't, but you can also convince yourself that you're the absolute best at something. So it's a funny thing, doubt. I don't think I'm immune to it, but I'm trying to, put things in place, systems that help me realize that there is potential that I can unlock to.
Yeah. Now, we also talk about this younger version of ourselves where this doubt usually comes from. And one of them is you have to love that version of yourself, right? That imposter syndrome, that need to excel all the time. It's not an unhealthy thing. It's also a version of yourself that deserves love and some grace. And I think we often, like people, the first thing you said is, I wish you could slap your younger you. Man, that's where you got your resilience from, So don't slap him. Or maybe just like before you meet certain people.
I think also with regards to, if I look at my life and it's sit there going, you could slap yourself. I did some stupid things.
Yeah.
Like, I think all of us, but also like the lessons that were learned from that. Thankfully, the consequences were not dire. Sometimes you do something really stupid and the consequences are, there is no coming back from it.
Yeah.
Well, I'm very much of the philosophy that it's never a mistake, always a lesson, but you have to learn that lesson. Yeah. And I think life will keep presenting that same problem over and over and over again until you learn it. And if you have to learn it the hard way, well, that's going to suck. Yeah. But then you won't forget it.
I think while you're making the mistake, you're like, this is a mistake, this is a mistake, this is a mistake. I'm going to do it anyway, but this is a mistake.
This is future Sean's going to hate me right now.
Oh, man.
Man, that guy's
PK myself right now.
I'm so mad.
And also, I think as we get older, we become, as we were speaking about resilience and even confidence within ourselves and our own abilities, as we start, it's like, oh, I can do this. It's like trying something for the first time. You have that shock factor, like, am I? And then it just becomes easier and easier and easier. I'm sure pretty much like when you went into the aesthetics realm, your first set of lips, you must have been like,
oh yeah. I can tell you with 100% transparency that my hand was not as stable then as what it is now.
I'm not 100% sure.
So I kind of ventured into aesthetics pretty early. I was actually still a public service doctor. Okay. And it got to a point where I had to make a decision. This was around COVID, and I was working in emergency medicine, had a postgraduate qualification in emergency medicine, and the world kind of opens up to you at that stage. So I thought, this is a great opportunity to actually go travel and work abroad. The cruise ships were an option. You get to, meet new people, work in a different functional system. It's first world medicine, and you get paid in dollars that are tax-free. All the win. And then the cruise ship industry just turned on its head because of COVID. No more cruise ships, no more travel. what do you do? And I remember Vincent and I were on the phone constantly. We kind of wanted to start a little business that could leverage PPE, like masks and all kinds of things COVID related. And, you know, we were always one step behind, unfortunately. So, you know, we jumped on things like oxygen concentrators and whatnot, but it never really came to fruition. So we're now at this point where most doctors commit to a speciality. I think both of us were surgically inclined. We were both entertaining either orthopedics or plastics. But the reality of South Africa is that as a white male, your opportunity to get a specialist post, you're a little bit low on the list. So do you work in a department indefinitely until a post becomes available? Okay, that could be 1 year, 2 year, 3 years, if not more. Still specialize for 4 or 5 years, and then you only start much, much later in life your private practice. Or do we take a gamble, start our own private practice, starting off as general practitioners, but focusing on something very niche and specific? And aesthetics was kind of the entry into that. But because my dad's been doing aesthetics for a long time, I was like, this is going to come naturally to me. So I went to my very first botox course, and I consider myself a pretty charming and charismatic guy. You know, I arranged this patient. I was like, this is going to be amazing. Like, studied beforehand, all the anatomy, the doses. I'm like, piece of cake. Until you hold that needle in your hand and you have to do that very first injection, and you're like, no one's actually taught me how to stabilize this injecting hand. So now it's like, I know what I need to do, but my hand's not doing the same.
Not doing the thing.
And that was just an interesting thing for me to learn. I was like, wow, you know, I've been putting in chest drains in patients, working with blood, suturing, like while the chests are literally open, doing sutures and all kinds of gnarly things in public. But as soon as I'm in a private practice and I have to do a tiny little injection in someone's face, I got the shakes. So that was an eye-opener for me, that something so small could have had such a big impact.
That's so cool, because, you know, this thing that's been on my mind of late, and we actually heard about it at church, is this idea of permission. Right? Like the biblical and religious is that you don't need permission. Permission is given to you. So that which is yours is supposed to be yours to pursue, right? That's pretty transferable. And when we look at kind of your path to what you're doing, is that you gave yourself a lot of permission off of context. Like, my dad's done aesthetics. Genetically, I obviously can administer aesthetics, right? And you sat there and you're too deep in to kind of quit. Right? It's like a lot of guys don't have that opportunity, or they don't give themselves the permission to do something that's like wild and out there. So did you ever, I mean, you had it when the needle was in your hand, but going up to that, like when you were chatting with Vincent, did you ever have these doubts and like, maybe I should just do the safe thing, do the cautious thing?
No. No. I think once I put my mind to something, I can convince myself that I'm capable. So I can tell you that, you know, as I've kind of evolved in this field, I'm now in this position where I train other doctors to inject. And what I've just realized is when you learn a new skill, you have to go apply that skill immediately to create the solid foundation in order to continue doing it. And many people get scared. They might realize, just like myself, okay, you know, I've got a shaky hand, maybe this isn't for me, and quit straight away.
Performance anxiety.
Perhaps. But I would rather just throw myself back into the deep end and see, well, let's go one more round and see if I can take them down this time.
People pay years of therapy to get that kind of resilience. No, they do. They do. That's like,
That's why I'm laughing.
yeah. It's obviously ingrained in you, and that's, you always been like, okay, if I don't do this, then I'm just gonna do it again. Like, it'll happen.
I think it's just becoming comfortable with the uncomfortable. And a perfect example of this is public speaking. You know, they say that public speaking is the biggest fear in the world. The second biggest fear is death. So you're more afraid to speak for the eulogy than you are to be in the coffin, which is pretty crazy. And I've just realized that, fortunately I was granted an opportunity in high school to do Toastmasters, which is a public speaking type forum.
Yeah, same.
And after that, the opportunities to present in university were slightly less. And I mean, you speak in front of peers and colleagues on a ward round, but not really in front of a massive auditorium. But as I've been in private practice, that's kind of changed. So now you're working with companies and you have to speak in front of a larger group. And it's about just deliberately exposing yourself until that performance anxiety kind of disappears.
There's that old book, I think I've referenced it before. It's The Magic of Thinking Big. You know it?
I haven't read it.
It's probably one of the first self-help books.
My wish list.
Yeah, it is well worth it. It is something that's aged very well. And the one kind of motto they have there is action cures fear. You know, it's like if you can't do it, not scared, do it scared. So that idea of that you've just got to
Fake it till you make it.
Yeah.
Yeah. It's called exposure therapy. No, I'm serious. In certain instances of anxiety, so social anxieties, you have to expose them to that uncomfortable situation. You've got to face your fear. So exposure therapy.
And did you see anything when you were going and doing your rounds, right, as a newly qualified doctor, that made you go, oh, shit, I should have done business?
Guy comes in with 27 gunshot wounds and be like,
No, not patience. So I've never had a weak stomach or anything like that. I find the human body exceptionally fascinating. I enjoyed emergency medicine because of trauma. You can get this polytrauma motor vehicle accident patient that comes in, limb is hanging by a thread, and you got to resuscitate them, ensure that they live. Yeah. So never had a problem with that. But you can get exceptionally intimidated by specialist consultants. So there's definitely hierarchy in hospitals to this day, and that hierarchy is very well established. And I do believe that older generations of doctors still have a very patronizing approach to younger doctors. So rather than trying to lift them up, they'll talk them down. Yeah. And that became intimidating when you have to go and do an oral examination, for example, because you know who this person is because of their reputation sitting across from you, and they start firing questions at you, kind of like interrogating you. Yeah.
It's not a learning experience. It's
no.
Yeah, they want to sweat you out.
Exactly.
Yeah, but I also find that in many other industries. I'm diversified into quite a, and the thing is I think it's because they feel threatened. There's a lot of them that are actually like I found that with just in conversation and stuff like that, a lot of people become very threatened by a younger, this guy's already achieved X, Y, and Z, and I have to kind of like put my elbow into him to make sure he stays in place. I think it's actually.
I agree with you.
It's like it's actually just like a really shitty characteristic that they have. They just feel threatened by it.
Well, I can tell you from my experience with being exposed to those doctors in very specific specialities, that based on my interactions with them, that was a speciality I did not want to pursue, purely because of them. I was like, if this is how you act and this is your job, or this is what you've made your career of.
But maybe it worked then. Maybe it is a deterrent. Right? To stay. Listen, it's. I always say, if you think bullying at school is bad, wait till you get to corporate.
Okay.
Right?
Corporate's dog eat dog, though.
No, it is. It's there was a CIA agent who focused in espionage. Right? His study was espionage, and he decided to get out of the CIA. And he said the next place he found sociopaths was corporate, and he became a corporate consultant. And he said the behavior you see with these guys is sociopathic. And you deal with guys. Some of the worst bullying I've ever had in my life is from guys who had far more money than me, higher positions, years above me. And I think it just must be a human thing to be shitty. But I think you're right. People go and they look at you and they say, yeah, this young buck's not going to take my job.
But how do you think they are outside of that environment, outside of corporate? You know, like these doctors, are you acting like this because there's an established hierarchy and you know where you sit in that hierarchy? Or outside of the hospital, are you a lovely human being that...
How you do anything is how you do everything.
No, it's just...
I prescribe to that.
If you're puss at work, you're puss outside. Just like...
Yeah.
If you're not a nice human being in a working environment, the chances are you're not really nice to the waitress that's serving your food, type story.
And Rob said something interesting today, and I think it was because he was losing blood because of leg day.
Here, more there.
But no, he said something really interesting about righteous indignation, righteous fury, tipping tables in the temple, as the Bible says. And there's a place for being hard. There's a place for putting people in their life, like especially with you. Like you guys are saving lives, so you get it that people are going to be like drag you by the collar. But you know, and as they say in corporate, and it's probably transferable to an element in what you do. But people don't leave businesses or specialties; they leave people. Right? You leave leaders or the lack of leaders. Like any time I've jumped companies, it's been because the leader couldn't. So the guys, they didn't get you, they didn't want you to specialize. So now, maybe that worked. But look at you now.
Look at me now.
Well, I mean, like I was saying earlier, I mean, you've got an amazing reputation from any of the peer groups that I've spoken to when you're not around. And I mean, I think it's, when I hear someone say, oh, I was speaking to my mom about you, and I'd be like, huh? Like, what the hell?
I'm talking about him in his gym shorts though, or at work?
Shut up.
Because they both attract an equal amount of positive attention.
Hey, listen, what the lady...
Distracts my gym partner.
What? Who's distracting what now? Leave me out of this.
But we were chatting a little bit about this earlier around, and it's probably a rites of passage as well. Right? There's a lot of people that are being dicks because people were dicks to them, and they go, it's a hardening agent. You know, it'll polish the diamond.
I don't know. I think that it, like for me, I feel it made me more empathetic.
Yeah.
Like you know, you can either be the one. It's the whole story of, you know, the two brothers and the alcoholic father.
Yeah.
The one is, why are you an alcoholic? And because my dad was one. And the other one was, why don't you drink? And he's like, because my dad was an alcoholic. Yeah. So it's either you go, okay, well, this is the norm, I accept it, or this is the norm and I'm going to go against it.
Do you think that hierarchy can change? That idea of that, how it runs, and how would you do it?
I think hierarchy exists in the natural world for a reason. It provides structure and it follows a system, because where you fall in the hierarchy determines your roles and your responsibilities. I think the hierarchy can be improved, but I think it is necessary. You need someone at the top that's a decision maker, that's assertive, that knows what they're doing. And you need someone at the bottom that can go and execute those tasks. So I think it has value, but I think it's flawed.
We see it all the time, and people often go and they hold reverence for, oh, you're a CA. Oh, that's great. And you must be smart. And I say, no. I've worked with far too many dumb CAs for that to always be a compliment. Okay? Like, guys,
how many stupid doctors do you know?
Yeah, I've had clients come up to me when I was on audit. They said, if you send this guy back into my office, you're going to lose his audit. Like, and that happened way too often for it to be an anomaly. Like, this designation doesn't always afford people one EQ. Okay, this being academically inclined. But two, there is also that, how do I talk nicely to a guy that is infuriating one of my biggest, invoices? Hey, listen here, buddy. Walk in nicely. Don't be an irritating prick. do the work, client's got to pay us. You know? I don't know, is it something that's completely isolated to that, or do you know some pretty dumb doctors? If you want to name and shame, now's the time.
Fortunately, I work with a very strong group of doctors. I've surrounded myself with people that I think also elevate my own skills and knowledge. But it's not to say that I haven't been exposed to very questionable doctors. And, you know, what the fundamental reason behind that is difficult for me to say. It could be their own personalities, demeanors, their approaches to whether it's conflict resolution, patient management, culture. Those are all things that I think play an influence. Ethics, absolutely. Very questionable ethics.
I mean, there was that story in a hospital here where the guy was doing stents in people's hearts who didn't need it. I'm sure you've read about it. And then one of the doctors was actually, there was an attempted assassination on him because he was one of the whistleblowers. So, I mean...
Oh, but in the same light, I mean, there was someone on the JSC the other day that was lying about the PhD from London Business School. And, you know, I don't think...
It just boils down to ethics.
Being a douche is limited to a certain...
No, it's just...
profession.
Yeah, it just comes down to ethics.
I think it's humans. Humans are shitty.
And again, it comes down to, remember the 7 that I would eventually like to discuss in detail. But, I mean, I think pride and ego definitely gets in the way. Greed feeds people, leads people to do things that they shouldn't do, want to do, etc. You know, this fueling of some lust or desire of sort. So I think ethics is a huge factor into any faculty or factor.
Yeah, and not to delve too much into probably what is a private idea, but are you spiritual, religious?
So I grew up in a Christian household. I mean, we used to go to church every Sunday. To this day, we say grace before we eat. I consider myself a spiritual person. I think I believe in a higher power, but I don't follow a specific religion. It's not to say that I don't believe in religion. I'm sure there, throughout history, were these individuals that had disciples and that they had, you know, knowledge and, I don't know, a way of life that uplifted people and made them look up to them. Yeah. But I try to take what I've learned from people from different backgrounds and cultures and just be the best human that I can. You know, so I've had friends who are Buddhists, I've had friends who are Muslims, and there are certain characteristics of their religion which I admire. Yeah. I'm like, the way you approach life because of your religion is admirable. Yeah.
And try to take the best of those worlds.
And I try to adopt that into my own.
Yeah.
But, you know, the truth is religion's caused more war than anything. Yeah. We can see what's going on at the moment in the Middle East. It's crazy.
14 countries at war at the moment.
Yeah.
Now, Nietzsche talks about nihilism, which is the idea of loss of God, right? Is that you stop believing in God entirely. But there is the other side of it where you only believe that is the only thing that matters, which is a mirror image of nihilism, is that, well, if I took that away from you, you would be nothing. And that's not the case, right? So, but the reason I reference kind of a higher power or a being is, and I was chatting to a friend that's an atheist. I said, well, what stops you, right? And there's going to be atheists swearing at me, but the idea is, what stops you, or what governs the way you act? Because someone could easily say, well, I need the Bible to tell me how not to be a douchebag. And I'm like, well, that's a pretty shitty way to live your life. Right? Like, so how do you, what makes you, yes, you've got the code of conduct and the ethics, but if you, at your core, like, what governs that which is good versus that which isn't for you?
I think it's examples that have been set to me by people that I look up to. You know, whether it's my parents, whether it's my older sister who's 10 years older than me, whether it's friends or other family. That's kind of how I would govern it. Yeah.
I think there's a little bit of community funding. Like that's the idea of my...
Empathy is a very big one. Yes. When it comes down to, you know, when it comes down to how am I going to be with other people, it's empathy. I mean, am I going to, is what I'm doing going to be good for my peers, for society, for, myself?
The community.
For the community, yes.
Yeah.
I think empathy is probably, I mean, if you were to base your decision making on empathy, you'd also make a couple of stupid ones because you feel sorry for people and you go out of your way when you shouldn't, the Good Samaritan story. But I think if you let empathy guide your morals and ethics, I think it's a good foundation.
It's like a blockchain, If it's like, why don't you cheat on your partner? This is the question I asked my atheist friend. They said, well, it'd be frowned upon. So I said, so it's not because you wouldn't feel cool. It's because people would make you feel shitty. And I wasn't trying to null and void. I was trying to understand. And I think we are governed by the norm, right? If we look at the law of averages, that being a decent person actually is pretty cool in your community. So look at this guy, he's doing good work, he does it in an ethical way, he uplifts those that work around him. Yeah, his patients always walk away never frowning, but that's just because his aesthetics is so good.
They're frowning, but only for about a week. After, then the botox sets in and everything dies.
Like I often say to Rob, one of the things I try and rationalize when people do stuff is what is our primordial programming? What are we like biologically, instinctively going to do? And I think
self-preservation.
Not pissing off.
Biologically, we're savages.
Yeah.
Yeah, self-preservation.
We are, so when you ask me how do I govern it, oftentimes when I'm faced with a decision, I try to think about perspective. You flip the roles. If you're thinking about something and you're like, is this the right thing or the wrong thing? Flip the role. What if that person had to do that specific thing to you? How would it make you feel? Yeah. And I think at that point you realize, okay, maybe that's a shitty thing to do. Don't do that.
That's a cool level of self-awareness though. Like we talk about that as being the observer, not the participant. Right? As you get to remove yourself from but even then, it's kind of community governed. Is you're going, shit. And I think even as savages, like if we were in this tribe or this troop running around, you're like, I better not steal this dude's bananas because he's probably going to go ape on me. So as savages, there's still like this rule of thumb that don't be a douche.
Don't take his banana, otherwise he puts his banana in your babe. That's the problem.
You have to find new bananas and a new tribe.
Another question that I wanted to go into, and now I think we need to start focusing a little bit on topics that I'd mentioned earlier. Testosterone and the
more the better, hey?
Well, they say the devil's in the dosing, hey? But you're still playing with the devil. No, I mean, we had this discussion the other day with an earlier guest, but I mean, you as a doctor, and I think this is something that a lot of people need to hear, need to speak about and hear, is testosterone in men. As it starts to deplete, I mean, energy levels go down, libido goes down, confidence goes down, fat stores go up, muscle loss, mood changes. So if we were to give a quick synopsis on, what would be, one, where do we start? How do we fix it? Obviously, blood tests. Go to your practitioner or GP or somebody. Check out your levels. If you're feeling low, etc., etc. If you're starting to lose lust give us a bit about that.
Testosterone is a hot topic, and I think it's an overlooked topic. Men are becoming more aware of it, but most of the men that are really affected by hypogonadism or low testosterone levels are part of a generation where I think toxic masculinity is still very rife. It's suck it up, buttercup, keep going.
Yeah.
And that becomes problematic because I feel like there are repercussions to leaving something like that untreated. Most of the patients, as you've mentioned correctly, the way they would present is unexplainable fatigue. I don't feel like myself. I've lost my drive. it can be subtle. So they'd be like, oh, maybe I didn't sleep well enough, which is also, interestingly, another side effect of low testosterone. Or I'm burnt out from work. And then they just kind of ignore it. They might, find their fixes in things like caffeine, nicotine, or other things. But I've seen so much value from helping someone optimize their testosterone. I mean, just this past week, there's a patient of mine who owns a call center, and he just felt that, he just doesn't have the concentration to get through the day, motivation to go and train. He doesn't know what's up. So we tested his testosterone levels. They came back low. We put him on therapy, followed up 6 weeks later, and he's a completely different person. I mean, he walked in with like a rhythm in his step. And I was like, okay, dude's got his mojo back, win. And I think as soon as you realize, great, I'm more like myself now, it becomes easier to achieve your goals.
Yeah.
And we have to remember that many people think that testosterone's got to do with muscle building or libido.
Yeah.
Testosterone's main function is to make effort feel good. Any effort. Work, life, relationships, exercise.
That's such a nice way to explain it.
Yeah.
Overdosing.
Common.
We get this.
Common.
A lot of the guys, especially the younger guys, and I mean, look, I was one of them. Anabolic users in my 20s.
How do you know a gram didn't work, Rob?
I never went to stupid.
Because I tried it.
Pretty much. I mean, like, I always sat there and I used to listen to, especially in the bodybuilding industry and the community, these oaks were pushing themselves to literally a gram a week, if not more.
Sure.
The repercussions to that. I mean, let's hear it from somebody who's, because they can hear it from me, but they're like, what do you know? You're not a doctor. So let's hear the doctor.
Happy to unpack this one. So TRT, or testosterone replacement therapy, is exactly what the word says. We're trying to replace what's been lost. We're trying to put you into optimal ranges that are still part of normal physiology, not in super physiological ranges. The issue is, there's a massive gym community around the world. Gym bros all around, if they're on testosterone, think that the more the better. And what they don't understand is that there's actually a point of diminished returns. So there's a bit of a ceiling effect. And at that point, that's kind of where the side effects really start happening, all the bad side effects that people talk about. Whether it's shrinking of your testes, accelerated hair loss, oily skin, acne, mood changes, those things are real. Aggression, very labile mood, up one day, down the next day.
Well, roid rage. I blame trend, but yes.
Yeah, other anabolics have a range of their own side effects, but testosterone specifically, that's one of the problems. And what we don't realize is that you need testosterone as a male for it to convert into estrogen. And with too much testosterone, that conversion into estrogen can cause permanent physical changes. A very detrimental one, gynecomastia. And that is something that I think is more common than what people think. You can actually see it on bodybuilding stages quite clearly.
Especially when they get down to such low fat levels.
Yeah.
I mean, it's the one place that doesn't lose the fat.
And even in instances, I've been on holiday, tropical island somewhere on the beach, and there's a guy who looks shredded, but he's got these man boobs, and it's just like, that's a pity.
Yeah.
And they don't realize that can have a massive effect on your mental well-being, because there's a fine line where you can't reverse it anymore, and then you need surgery to go and remove that.
It's one of those weird drugs that plays on people's minds in the ways that it makes you aesthetically pleasing. It makes you stand out. And what we often see in the bodybuilding world is that people say, oh, he's got great genetics. You don't know how deep that goes. He
Normally
could be to
about 30 centimeters.
No, but it could be to the
30
point.
centimeters.
3 centimeters.
Hey,
Oh, sorry.
Jeez,
30 millimeters.
The bar is high.
No, that would go right through you.
Yeah. So, we would see guys that you say, oh, he's got great genetics. But what that could sometimes mean is that his body just doesn't deal with toxicity from testosterone or gear as much. Now you're using this guy who looks great, doesn't have many sides, and you're saying, oh, well, that's the benchmark. We had this. I remember we were in varsity, and the guys were like, okay, cool, we're going to try a bottle of tests. Guys got it. One guy got gyno. Who knows if he was doing anything else, but one guy got gyno. So all the same stuff, using all the same compounds, same doses, whatever, training the same, eating the same, all had this aspiration to be the next Ronnie Coleman. But that guy, he was like, oh, I got a bad batch. So you're like, fine, source your own stuff. His body just didn't, and we got you obviously get dosing on a forum.
Yeah, some people will be more sensitive to, I mean, it's like that with any drug though. Some people would need a little bit more, some people need a little bit less.
And what is the process, like how's the time frame? So if someone says, they see this, they go, you've described probably what I would say the majority of men feel. Right? There's some symptom there and some guys going, oh shit, that could be me. So what does that look like? They phone in, they book an appointment, you send them for bloods, turnaround times?
It starts with a quick chat. We basically put you a series of questions, around 10, to kind of figure out what the severity of your symptoms are, and a blood test that confirms it. Turnaround time for blood tests, on average, 36 to 48 hours. Sometimes a little bit faster, sometimes a little bit slower. But it's about a day. And once you've got that, then you can actually tailor the dose that they need based on what that blood result says and based on what their symptoms are. So it's not really a cookie cutter thing. It's not to say everybody today gets 250 milligrams of test a week. Yeah. It doesn't work that way, because what you need and what you need is going to be different. Yeah. And then follow-up is typically at the 6-week mark. By that time, you should have super stable blood levels. And then you reassess. What are your symptoms like? What are your blood values like? Do you need to make a tiny adjustment up or down just to keep you exactly where you are? And that's really it in a nutshell.
The risk is that you've put the solution in a bottle, which us bodybuilders are trying not to tell people is the case. No, man, you need to do this for decades before you go.
I can tell people now that testosterone is not going to make you jacked. Jacked comes from hard work. You got to lift, you got to eat clean, and you got to eat in surplus. And what people don't understand from muscle building or just general bodybuilding is that I think eating is what defines a good athlete from somebody that's just doing this for shits and giggles. Because I've tried it. Yeah. Eating 3,500 calories is hard.
It's a lot of food.
It's a lot of food, and I can't sustain it. I actually, eating all of that food actually started making me feel lethargic. I mean, I was 83 kilos, I looked lean, mean, and strong, but for me, my body just didn't like that. So, I mean, hats off to the people that make it in bodybuilding. I don't think it's an easy sport. I think it's quite tough. I think it's quite a lonely sport.
Yeah, I also always found it to be very. It is. It's an eye sport. It's not a team sport. It's about you, and and also in order to become good at anything, you've almost got to become obsessive over it.
Oh, you do, yeah.
There's no. It's it's like when Sheldon's in prep. Don't even ask him to come out for dinner. He's gonna say, "Hey, listen, bro, I'm bringing my lunch tin." Like,
there's a lot of sacrifice that goes into bodybuilding. It's massive sacrifice, and it's definitely not for everybody.
No, it's a special kind of dedication.
Yeah, obsession. You got to be crazy to do this.
It is in order to become, and I think it's like that with almost anything though. If you want to be the best, you have to obsess.
I agree, but what I think defines or creates a big difference with bodybuilding is that you're constantly comparing yourself to other people and their aesthetic. I mean, that's the name of the game. Yeah. And I think that can become pathological in a way, just on your own mental health.
Yeah, you're right. Yeah, listen, I mean, we get most of our recruits from body dysmorphia and eating disorders. You know, often say, or injuries. Yeah, we do.
Bullied victims.
But powerlifters, they injure themselves. Like, I'm like, hey, you can't lift heavy, but you can look good. Hey, join us. Join us. I mean, most of the guys who are doing this do not have a good relationship with self-image and food. Okay? It's not to say all of it. I mean, mine came from that. That's how, and then I just fell in love with it. But it does. It stems from this always comparing yourself. When I do prep, like I've got a couple of years under my belt, I actually don't look at social media because all I know is I need to be better than the last time, right? If I'm better than the last time, then I've improved. And if some guy decides to come out of the woodwork, there is nothing I can do within my power to beat that guy, right? If I beat my last condition, my last showing, that's fine. That's all I could do. But that took years and years in the sport.
What I think just sucks about the sport is that you've got somebody judging you from that perspective.
Just never stood on the stage.
Well, exactly. You know, so there's a lot of subjectivity in it. You know, because I've been a big fan of bodybuilding my whole life, and you know, when you watch the Mr. Olympia and you see these guys, and you're like, actually don't know who looks better. These guys all look phenomenal. You know, does it come down to the posing routine? What does it really come down to? But they're all jacked motherfuckers.
Yeah, no,
Yeah.
Look, I think genetics, when it gets to that level, plays a massive role.
100%. Yeah.
I mean, like, and also the difference between amazing and mastery is only like 5%. You know, it's like I even said to, like, with the artists here in the studio, the difference between a good tattoo and an amazing tattoo is that 5% of extra detail. It's just that little bit that you're gonna look at it and go, wow, look at that, just that, you know. Or like, for instance, the eye. If you're doing a portrait, you screw it up. The I is an O, not a U. Does that make sense? And the problem is you're out by 1 millimeter, that O's a U. And it's the attention to detail. It's that extra, just that 1% that makes it. And I think when it gets to that level of the sport, it's that 0.1% that have the genetics to get there and stay there.
And it is subjective. I mean, we say it depends on how big the guy is talking about it, but it is a pageant, right?
Yeah.
If you sat next to 120 kg bodybuilder, don't mention that. You know, call it a sport.
That's the other thing. You know, people think you can take testosterone and be jacked. Just because you're jacked doesn't mean you can fight.
Yeah, dude.
No, they're actually easy.
Yeah.
You find the bigger they are, the harder they fall, and it's true.
Look, I don't wanna
because
find
they're
out.
slow.
Take your
They
advice.
are slow. They're slow as fuck.
Yeah.
They don't know how.
We've been trying to hit Rob for years.
And be like, dude, I've hit you 3 times by the time
haven't
you've got
caught up.
roof. Another one that we wanted to discuss was penis enlargement. I think this is a very big topic with men. A lot of people, and there's also a lot of shit that is for sale.
Yeah.
From my understanding, to cause hyperplasmia in the penis to make it grow, one, it's attached to your pelvic bone via a tendon. Ligament. There we go. That's why he's a doctor.
Yeah.
So it's attached to the pelvic bone. Once that has reached full length, that's it. So in terms of length of penis, barring cutting the ligament, which then makes you flaccid, there's nothing you can do to increase its length.
No.
Really?
Not safely.
Alpostratal injected, I believe, can, but huge risk, as you were saying, not safely.
Penis enlargements has been around forever, right? All kinds of lotions and potions existed to bring back lost lover, right?
Yeah.
Only $5.
Exactly. But you're very right. So you can perform a surgical procedure. It's called a suspensory ligament ligation. So in the pubic area, you can go and cut this ligament. And then technically, yes, your penis will be longer. But the issue is it affects your erection's angle. So if you at full mast like this and you go and cut that ligament, you're going to go drop down to this. So do I think it's worth it? no. Surgery carries all kinds of risks, whether it's infections, nerve damage, scarring, and so forth. So this is a safer approach to people that want to augment. And there's a lot of taboo and stigma around augmentation, but women get stuff done all the time, whether it's lips, tits, bums. So I don't know why we have to think about this any differently. Men are currently really focused on image with regards to things like hair. But
yeah, it was big for me. I went 2 months ago.
And it can do a lot for your self-perception and for your confidence. And I think below the belt, the same thing applies. They did this massive study and interviewed a couple of thousand men. It was 5,000 men from all kinds of different nationalities and backgrounds, and asked them, if you could have a bigger penis, would you? And 97% said yes. So I mean, everybody wants a bigger dick, right?
Yeah.
And essentially what the procedure entails is you use hyaluronic acid, which is a filler. It's the same type of stuff that we use in facial aesthetics. So if someone had to come and do lips, but we're just using a lot more. You're injecting it from the base to the tip and right around. And it's primarily a girth-enhancing procedure. Girth, when it comes to intimacy and sexual pleasure, is actually far more important in heterosexual men that are having intercourse with females. The more surface contact you have with the vaginal canal, the more pleasurable it is for them. There's a sense of fullness or pressure, where length is actually not all that important because the canal's only so long.
You want to hit the G-spot, not the bladder.
Well, exactly. So you're just going to end up hitting the cervix. It's going to not be more pleasurable for them. However, because the actual product has weight to it, when you are flaccid, it appears much longer because it kind of stretches down because of gravity, if you can think about it that way. So I tell guys that it gives you that locker room confidence. You could be that guy in Virgin Active, walking around without his towel, naked, for no good reason.
Like the old bullies do.
Yeah. Exactly. Not a care in the world.
Maybe I was in the army.
No, but that's how it hangs now. Maybe just age has actually favored them in this time.
Yeah. Well, that's the thing about age as well. So people ask me, what kind of patients come for this? All kinds of patients from every walk of life. I've seen guys in their early 20s, in their deep 60s, married guys, single guys. It's really everyone. But the thing with aging is that skin changes. It becomes atrophic or thin. There's loss of collagen. And it can cause a degree of atrophy or shrinkage. So when you use hyaluronic acid, it kind of just fills it back up. It restores that. But, 99 out of 100 guys, after I do this procedure for them, will come back asking for more. And the reason is there's a degree of swelling that happens within the first week or two, and they like the way it looks when it was swollen. So they come back and they're like, doc, just a little bit more. So sometimes there's a fine line where you don't want to distort the anatomy and make it look abnormal. So there's a degree of artistry with this.
People do this with synthol in their biceps. Yeah. You get to a point and you're like, what have you done?
You can see.
10-10, don't recommend.
This is why you would want to go to someone that's well versed in the idea. So the question I want to ask, right, starting at kind of zero, is how does a guy realize, right, without the obvious woman giggling at you when you remove your trousers in the bedroom, that this is something for you?
I don't think it would ever really be the situation where it's someone else's opinion of it. It's your own opinion.
Yeah, I mean,
we had a guy who we called Stompy, right?
Sure.
And that only came out when, after rugby games. Okay. So I imagine this.
You were the bully.
Listen, I'm just saying, this is Cinderella, the shoe fit.
Stompy.
So, that's the kind of remark that would probably get a guy to come in and chat to you. But for someone that's not looking at this or hasn't even thought about it, do you need to be symptomatic? Do you have to be in a place where I'm like, oh, my sexual performance isn't great, or maybe a bit of girth here will be better for me? Or is it just like, this is something that every dude that's sexually active should consider?
97% won't. Bigger dicks.
Yeah, I also think it's also remember, most guys will go if
He's going to be phoning you tomorrow.
No.
Guarantee you now, he's going to make an appointment tomorrow.
Yeah, bring it to the gym, bro.
I've got the body filler.
But there's also the pseudo masculinity that follows around dick size. Is that how many guys?
Yeah.
If you had to put gents in a room and say, take the size condom you want, and you put small, medium, and large, and extra large, you're gonna get guys that are in this space, right? There's this bravado. And I think, listen, I think I can imagine the confidence it gives, but it is a new world. So you're saying every dude should just?
No, this is definitely not for everybody. Okay. I think you need to be in a very healthy mental space for this. You need to understand that this is still a medical procedure, right? You can't just come in. Like at a McDonald's and say, supersize me, right? It's not a milkshake.
Come on, Doc.
$2 extra.
Come on. Just an extra 2 mils.
And I think you have to have realistic expectations of what it can actually do. In those instances, those are good candidates, but not for everybody, absolutely not.
Yeah.
You have to have positive body image.
But I'm right in saying that there is no pill,
We can talk about a prostadil for a moment. So we use it quite often. It's actually a form of erectile dysfunction treatment. So when it comes to erectile dysfunction, there are a bunch of treatments that exist. The most popular ones that we are familiar with are called PDE5 inhibitors. These are your tadalafils, your sildenafils, or Viagra and Cialis. But it can get to a point where you become non-responsive to these treatments. Okay, or only partially responsive, whether you've got background medical problems, heart disease, HIV, diabetes, things that can affect nerves or blood flow, then we have to think about other treatments that exist. We get peptides, one of which is called PT141 or bremelanotide. This is administered and it doesn't actually create a vascular response, it creates what's called a neuroendocrine response. So the signal for the erection comes from your brain. So this is typically in cases where patients are not responding to PDE5s.
Is that injected subcutaneously or actually into the...
No, injected subcutaneously into the abdomen.
Okay.
Another option that we can consider is something called the P-shot. So the P-shot is where we draw your blood, typically about 15 mils worth, and we spin it in a machine called a centrifuge. The centrifuge will separate your blood into different components. Red cells, which normally carry oxygen, we discard. But there's a layer called platelet-rich plasma, or PRP, that's full of growth factors. And the best way to think about PRP is if you've ever fallen down and scraped your knee and you get a scab and you pick at that scab, there's that yellow gooey stuff, that's PRP. And these growth factors within these platelets can help to regenerate tissues. So you'll develop new skin, new hair, new blood vessels. And it's the blood vessels that we're interested in. So the P-shot can help treat erectile dysfunction by promoting new blood vessel growth. However, if you are still somebody that hasn't really had the response that we expect, the kind of final step in the ladder of treating erectile dysfunction are intracavernosal injections, of which a prostadil is one. So it's a very potent vasodilator. It's injected with a short needle, typically an insulin needle, into the penis, and it's injected. You can't have spontaneous sex with this, it has to be planned, because the moment you inject it, within a couple of minutes, your dick goes hard, okay? And it's not to say that you have resolution of that erection after you come.
Hey.
So you've got to stay seated for a couple of hours.
Potentially, especially if you overdose yourself. So the idea is always to start low, go slow, because the last thing you want is actually to have an erection that lasts 4 hours or longer. We call that priapism, and priapism is super dangerous and painful because no fresh oxygenated blood is going in. There are these buildup of toxic metabolites in the deoxygenated blood, and then that can cause necrosis or cell death.
I had my suspicions that injecting directly into your penis was dangerous. I'm just glad that you've reinforce that fear.
Dangerous if unsupervised.
So
I'm going to call Doc. I'm going to be like, Doc,
I'm about to get laid.
like,
I need you to
could you pop over? Just
I'm on a bender in Ibiza.
fly there, bring what you can, and be like, just wait there, honey.
Shit, well,
Doctor
just
knows
come to
these.
think of it, I mean, like, administering it, is this in a pen format or is this something you would have to...
Yeah, so they do come in pens. So it's called an auto injector.
Yeah.
So basically the needle will not be visible. You would press a button and it would go tsk, and it would do that for you.
Okay.
But the pens are typically a German product, quite difficult to get in South Africa at the moment. Cavaject is one of them. Yeah. So typically it will come in a vial and you draw it up into an insulin needle and then you administer it. It's a product that stays in the fridge. And you can't actually use it multiple times a week. There has to be at least a 2-day interval between treatments, ideally.
Jeez.
Sorry, babe, you can't get it tonight. You had it the night before.
Playing hard to
Requires
get.
a little bit of planning, unfortunately.
And then a question I wanted to ask around the injection, the testosterone treatment. So someone comes to you, they need a little bit of TRT, you give them a dose. How would they administer? Would you give them that to do in their own accord if they're happy?
Most men are comfortable to inject themselves. I feel lower, higher frequency doses are the best approach. It gives you the most stable blood levels. And the best way to do that is actually, if you had to draw a line straight from your knee up your thigh, the outer edge of your thigh, kind of in the mid zone over here, is the place of preference or the injection site of preference. So quite comfortably, you can sit in a chair, you can draw up your testosterone with a very short needle, not 30 centimeters. You can jab yourself.
Never gonna let this one down.
And then it's twice weekly administered. So there are many ways to cut a cake. Testosterone replacement therapy has got a bunch of different approaches. You can use higher doses less frequently, for example, once a week. You get blends of testosterone with half-lives that extend to 14 or 21 days, something like Sustanon is an example. And that allows a patient to come on average once a month. And then you get longer, higher dose acting testosterone, such as Nebido or testosterone undecanate. And that's every 8 to 10 weeks. They say 12 weeks, but I feel patients get caught on a dip if you wait the full 12 weeks. So around 10 weeks is kind of the sweet spot for those. And you individualize it. Some guys don't want to pin themselves. Others want the convenience of, okay, every 10th week I go to the doc, he gives me my script, they do a quick jab, and then off he goes to live his life. And then you get people that are completely averse to needles, and then you get topical forms of testosterone gels and creams. Unfortunately, absorption's variable. Yeah.
And oral, I know from experience, past and dealing with a lot of it, oral testosterone, just no.
Yeah, there's something called bioavailability.
Yeah, it just doesn't work.
That's this weird stigma we often have to get with guys, is that they'll come to us and be like, I want to start something. I'm like, okay. And they'll be like, I was reading forums and they recommend Anavar. And I'll just be like, it is safer to inject, right? To take something than just...
No,
but guys just want to, they're like, I don't want to inject. God, I don't want to do...
Safer than Dianabol, maybe.
Yeah, D-ball. Guys, D-ball.
So here's the problem, and once again, it comes to a lack of knowledge, is that guys are like, cool, I'm keen to jump onto something, but I don't want to pin myself, so they run to these oral medications. They do their research, they're like, okay, this is going to make me harder, vascular, look more pumped. But using those other anabolics actually shuts down your body's own testosterone production. Okay. It's how it works. So you take something like Dianabol or Anavar, and your body's inherent testosterone production just plummets, ceases to exist. And they're like, I don't know why I'm not getting the results that I anticipated, or
why my member no longer works.
Or after their 8 or 12-week course, whatever it may be, they get these side effects of low testosterone. So anabolics always requires testosterone as a base.
Yeah, and another thing I always have with guys is they'll say, get on a course, and then they'll be like, 6 weeks from the end of their course, bro science course they've run, they're like, okay, I need to start planning my PCT. Okay, and there's so much, again, on the internet around why treat symptoms before you have it, right? Or do you put your guys on something that would be considered a PCT?
Guys that have used anabolics that want to stop using anabolics need PCT if they want to recover their body's natural production of testosterone, and especially if they want to have children. Guys who are using testosterone replacement therapy that are done making their families, they can stay on testosterone replacement therapy for life. It's typically a lifelong commitment. If you are a young individual and you still want to have kids, it's not to say that TRT makes you impotent, but it does affect sperm count. But I've seen bodybuilders that are using all kinds of different products still popping buns in the oven. So, like I said, it doesn't make you completely infertile, but it reduces sperm count.
He's looking at me because I came back from Worlds. Obviously, we were in a all natural
worlds, yeah.
But you depleted.
And boom, baby.
Yeah. Tried enclomiphene and then I still blame.
Baby.
So he owes me half the school fees.
PCT, I think, is an important part of any anabolic cycle, especially if you're doing it in a cycle.
Guys are using it though between cycles. I think there's this. There's this idea of blast and cruise, and you blast and then you take a PCT and then you go and you bang it again. Yeah, and you hope that the Kevlar vest you're putting on is going to stop the tank from penetrating.
What does success look like to you from here? I mean, do you feel like you've reached your... Do you feel like you're now successful?
Peaked?
Have you
never peak? It's my philosophy.
But what do you envision for yourself over the next 20 years of your career?
I think success is a very fluid concept. Ultimately, it's about, are you achieving your goals, yes or no? And what I define as success 10 years ago is probably going to be different to what I define as success 10 years from now. So my definition of success is, am I keeping myself accountable for what I told myself I was going to do? Yes or no? So what does it look like 10 years from now? Difficult to say. I'm going to be a completely different person. But what does success look like now? I think it's upholding my values. It's providing a service to the community. It's creating a legacy. Those are all things that are important to me.
What's as important to you now?
Yeah.
Because something like we try and touch on with just everyone is like what success looked like to you in your 20s compared to what it looks like to you now. For instance, like for me, I always used to have this thing in my head saying to my mom, I need to have 10 companies making me 10,000 Rand a month. 15 years ago, that was a lot of money. Today, it's still a lot of money, but not as much as it was 15 years ago. Now that I've kind of reached these goals, do I feel successful? And I sit there going, not yet.
The goalpost always shifts.
And it's very important the goalpost always shifts, because I feel like if you score the goal and you stop, then die. Yeah. Type story. It's like if you have nothing else to pursue or work towards, why are you around?
The CEO of Aspen, Stephen Sard, has a motto. He calls it "Rest is rust." So I think complacency and mediocrity, at least for me, is unacceptable. And I will always try and better myself in some way. And it follows Maslow's hierarchy of needs. Right at the top of the hierarchy is something called self-actualization. So it's becoming the person that you were destined to be, unlocking your potential.
I was talking about this to someone today around the gold medal syndrome, right? Or the psychology between what happens with Olympic medalists when they do 4 years, sometimes it's 12 to prepare for the Olympics. They win their gold medal, they get home, and they're like, what now? you know. And I think that happens with men of meaning or people of meaning that have pursued and acquired. You realize there's no parade. No one's sitting there going, hey, well done on opening a practice, you've peaked. And you go, the most fun part around that whole thing was the journey.
Yeah, absolutely.
Right? And that is actually, someone asked me the other day, like, what were you proud of? What were some of your best moments of the week? And I sat there, I said, I don't like that question. I think I would rephrase the question to, did you set goals? Did you meet them? Or did you have the grace on yourself to redefine what those goals needed to be if you couldn't? But were you sincere in your effort? Like, I was proud that I had a plan, I stuck to it, and when I didn't, I sat there, I could talk to myself. And for me, a big thing around success is starting new endeavors and showing myself love and grace when it doesn't pan out as it used to. Not this kind of self-loathing, like, what the hell is wrong with you? You had a plan, you had a goal, you couldn't stick to it, you're useless. That propelled me for a long time. And I think it does. We sit there and we go, we should have been better. I can't remember who said it. There was a dude, and he's achieved not. Businessman, fit dude, family. He said, in spite of how hard I was on myself, I still made something of my life. You know, the next journey in his life is to show himself love and be graceful in that growth. And the weird thing is that he's actually progressing at the same, if not more, than he was. But that is that idea of self-actualization, is that awareness of the greatness of what we're doing.
Something that I think is so suitable just based on what we're talking about, this journey, is conveniently something Vincent sent me today on Instagram that I actually, if you don't mind, just want to pull out for a second. And when you read something like this, it's quite motivational. So, didn't know there was a song attached. So it says, the real flex isn't the trophy, it's the grit. It's the part where you keep showing up when no one was watching, when the only applause was your own heavy breath. The goal was never the medal, it was turning it into the kind of person who doesn't flinch, who doesn't fold. You don't need perfect conditions, you need drive, delusion, and a spine made of fire. The win? It's knowing you are the storm. And wherever you run, you bring the thunder.
Yeah.
No thunder.
It's that permission, right? You don't need it. Just go forth and conquer.